We are indeed live.
Great. Welcome to Back to Biz Live with Jared and Dave. Today we have Adriana Barros. She is a certified body talk practitioner. And last week we had somebody on who touched on this subject, and he actually suggested that we might want to get a body talk practitioner on here. And she happens to have been the next person in line to be interviewed. So nothing happens by coincidence, everything's for a reason. So without any further delay, Adriana, please introduce yourself and tell us who you are and what you do.
Hello, everybody. Hi, Dave. Hi, Vered. My name is Adriana Barros. I've been practicing body talk for the last 8 years, and which hasn't been always my background. I've always had a background in healthcare, some shape or form. I've always been involved in healthcare. So I was in office. I was interpreting for many years. And I think everything falls in place at the time that they're supposed to get together to meet. And I was really looking to doing something else, but I thought, like, I was at a job too. I was in the hospital. And this boss of mine, who was a doctor, was about to retire. A very good friend of mine at the time had experienced body talk. And she calls me out of nowhere and she tells me about this therapy she had gone through and she had experienced. And she's like, I just loved it. And I'm like, okay, so tell me more about it. But she couldn't. And then I was like, okay, fine, because it was not hard for me to, I was an easy sell. I don't like to say it that way, but there's no way to describe it. However, because I've had been already treated myself in the past with a naturopathy, a mix of Eastern, Western, and I was always looking into something more deep and something more substantial that could enhance my health style and my health status. And I said, you know what, give me the practitioner's number. I'll book myself a session. And that's exactly what I did. So I booked myself a session, and it was just a good shock, because it was different. It was something that I had never experienced before. And the approach versus Western medicine, Eastern Western medicine, even though the other Eastern practices would have a more of that approach that you're more used to, and sort of what you're getting into. But with body talk, I think nobody has any clue, and unless when you've experienced one time, at least what it is. And for me, it was very shocking, because the first thing that came up was my mom's death at a time, and which had been years before, but still was surfacing because it was buried in there somehow. Mm-hmm. And then things just start rolling from there. So, the healthcare background started. I thought, well, I want to maybe just learn more about this. I want to get into learning and understanding what I'm receiving on a treatment table. And I'm like, this is something I want to know in depth. I started, enrolling in courses and like taking courses here and there. And within 2 years, I got certified. And then I said, I thought I was going to be interpreting for the rest of my life. And no, it wasn't. I totally left it to the side. I'm like, I don't want to interpret anymore. I don't want to be in the box of the healthcare system anymore. And because there was not much room to grow, right? And with body talk, you just go anywhere you want. You're your own creator. You're like the painter on your own canvas. So, yeah.
Well, that's a really good place to start and end, right? Your introduction. But I'm really interested in knowing, first of all, we're going to talk about this canvas and what that means to you, because I see that you have a chart behind you. And I know that probably plays a lot into the body talk. So I'm really, my curiosity is piqued. But I'd like to talk about going back to what you were doing before, because this is, after all, back to biz. We're talking about business. We're talking about transitioning from career to career and progression also in the way that we get to where we're doing now from what we were doing before. Mm-hmm. So you mentioned that you were doing interpreting. What does that really mean?
Sure. So I have a bachelor's degree in language and literature, and I specialize in translating and interpreting. So I never really, I did translation for a while, but it was not my thing. I'm more a voice person. I have to communicate. And so I started interpreting. So you're translating voice, you speaking, right? Versus writing, you're just talking the translation, let's put it that way. So so I have a few languages in my pocket. So I was interpreting at a time. So Portuguese is my mother tongue. And then English was my second language, but I also had Italian. So I was interpreting two languages in a healthcare. So I was doing the hand program at the Toronto Western Hospital for a long time. And I was doing clinics, I was doing home care, I was doing MVAs, like insurance companies. I was doing everything that had more or less to do with health. And then with that, I was just like, this is something that has to do with what I love, which is languages, but not the setup, right? So, and then I thought I wanted to grow as an interpreter. I wanted to experience and just have more room to do deeper things, unless I changed the field, which I didn't. I did one interpretation that was like the most important job of my life. I don't know if you guys remember back, that was in 2000, we had the World Youth Day in Toronto, where John Paul II came. So I was one of the Portuguese interpreters for him when he was here for about 5 days. I think we did that. Very challenging. My father had died just 5 days prior to that. So he was, and I was in the booth, right, with all those people, but it was, you know, a life experience. I'll never forget that one. And then I was, I didn't mention this, but I was also a mentor, a Bodytalk mentor for Bodytalk students in the Toronto Bodytalk clinic that we had, that lasted about 2 years. And so people who were studying Bodytalk and wanted to become certified, so they would go to practice, and we would have people from the community that would have low income people from the community that would come and receive sessions. So that was a good integration for people to receive the treatment, as well as for students to practice. And I was mentoring those students. So that was a great experience as well. And so that was over. And then after I graduated, I started practicing right away. And then, you know, clients just come from different odd places, right? You never know where they're going to come from. And here I am today. Had to shift my practice, which was something that fell in place as well with COVID, because before COVID, I've already wanted to work remotely. I never really wanted to have my office because I started thinking, if I have my remote office, I can work anywhere on the planet. I don't have to be stuck to a chair and table, right? And this is something I want to do in the future. So not be working here forever, in Toronto forever, but I want to move somewhere warm eventually.
Oh, okay.
I am a beach person, so yes, I need the sun to be happy. Although I have a great view, the lake view from where I'm at, but it's not the ocean. That's all I tell myself every day. It's not the ocean.
There is a difference.
Right? We know, Dave. But anyway, so that's something I have in my pocket that I want to expand that way. So now with COVID, I've been, you know, reaching out to more people, potential clients that actually start becoming, they're grasping more this concept of hands-off treatment, right? Because now, when we were in the lockdown, we can't really experience the hands-on at all or too much, right? And then people have no other way other than accept, right? Submit to this kind of vision, which is great, because this whole thing that's going on the planet, I think that makes us shift our mindset and start seeing things differently.
Yes.
So how difficult was it for you? I know, you know, people do translations, or many interpreters, but when you're talking about medical terms, when you're talking about, you know, different things that are only to the medical field, how difficult is that to interpret and to pass information back and forth? because I know that with the medical terms, with talking to doctors, practitioners, nurses, you have to have a certain language. So how did that translate for you? And is that different than just doing regular interpretations or, translation documents and things like that? Were you doing it only orally or also written?
So for translating, you have your resources at hand, right? So you rely on dictionaries and paper dictionaries or online dictionaries. So you have your own time in your hands, right, to do whatever you want. Whereas if you're interpreting, your dictionary must be in your head, or all your dictionaries must be in your head. And then you have to like go through the filing, and it's like, okay, pull this out, and it's pretty much what you have to do. But you have no time. So you have to be, so what happens is you have to grasp a certain jargon, as we say, of that specific field that you're interpreting. So what usually happens is that you start studying, right, for medical. So you never know, because if you're a freelance interpreter, which I was for many years, they call you on the spot. Or sometimes they call you a few days in advance and you booked, but then they cancel, and then you have to fill in somewhere else and you don't know where you're going, what it is for, right? And then oftentimes like, what am I doing today? Is this medical? Is this insurance? And then you have to rely on your data, basically, your mental data. And then you study, of course, you have to do some studying, so you have to be more familiar. Now, because I've stopped interpreting for a while now, since Bodytalk, your brain switches differently. It's like switches off. So for me, in order to go back and interpret again, it will require a little bit of training right now, because my mind is on to this. This is a lot of memorizing already, if you see behind me. So that's a different part of your brain that you're storing memories and messages differently, and relying on that kind of resource now differently.
Correct. Wow. Okay. So that's a lot. So you went from that to then getting into the body talk. And body talk is just like you said, another form of language. And so how does that play into our, therapy? How does that play into what people are using in order to help themselves to overcome any challenges, whether they're emotional, psychological, or physical? Does body talk address all of these areas?
It's funny how you placed it, and I really like it, because this is a language, and body talk is such a different language that you have to think outside the box, right? It's different. Even when we are learning it, that's why we have to take the course, the fundamentals course, twice, because the first time is like, what just happened? Even for people who had any kind of background, right? Because you might understand some nuances of what's in here, but how to navigate and what you're looking for in order to go to identify the areas of imbalance, of healing in the body mind, because this is the aim in body talk, and eventually heal, right? But this is not my job, it's the body's job. I'll just induce the body to do so, and we're going to get into that. So it is different approach that way. However, I could have said, I've been in healthcare all my life, except for the airline jobs that I had. I was in the airline business for 6.5 years. And that was back home. So since I've been in Canada, I've been in medical, strictly medical. But again, it might be a little easier for somebody who's got some background in like Chinese medicine, Western medicine, because they know their anatomy, they know physiology or whatnot. So the more knowledge you have in body talk, the deeper you can go in a session. Easier for you to identify, and you can go different places. But even if you have a more limited knowledge, it doesn't mean that you're not doing as deep of a job. Right? Because the body can go as deep as you can, but the results can be as awesome or even better sometimes. And sorry, I think I lost track.
So, no, that's okay. I'll bring you back. But before I do, you mentioned that you have to take it twice. Is that something that's mandatory?
It is.
Very interesting.
Yeah, Body Talk, just a little bit of background, was founded by an Australian doctor called John Viltime, who then eventually moved to Florida, and he's been based there since. And he founded the International Bodytalk Association that rules body talk on the planet. Body talk is practiced in over 50 countries, but there are only 2 countries in the world where body talk can be taken as a university degree. There's only a university program in Australia and in Germany. And you study it for 2.5 years before you're even allowed to practice. Whereas for us, in all other countries where body talk is practiced, we have to attend workshops. Those workshops are weekend workshops, like we're talking about 4 days each, to study a book that covers like a lot of material. And that's why then you're required to take it again, because after you study the first time, you study your, like, you know, at your own time, but you then start breaking it down, and then you grasp more the idea. When you take it the second time, you're supposed just to solve your doubts, like you have your questions answered and things like that. So then you can sit your exam, which is not easy to pass. But after that, then you get a certification and you start practicing and you're good to go.
Amazing. So it's interesting that they make you do it twice. I'm wondering why they don't just do like maybe an intro and then a graduated course after that, just like any other thing. Is there a particular reason why they did that?
I think it's really more a matter of covering everything. I'm sure that the way that the body talk fundamentals is taught today is maybe a little different from what it was 10 years ago when I took it, because the new edition of the book is different too, and how they cover. I know that maybe they added an extra day to the course, but I think it's just a matter of introducing and trying and make people exercise their left and right brain. Because in body talk, you do have to think outside the box in order for you to understand concepts. And that helps once you start practicing to start making sure that you start interpreting what's going on in that individual's body in a different way. Just don't go like black on white, because you have to think beyond. And this is, once you start practicing, you understand why they did it that way. Because when you start getting loosen, you know, like onto what you're doing, and then you start just navigating and you let yourself go, then you start making magic happen.
Right.
Okay.
Adriana.
So, yeah, just to get back to the question before you go on with yours, she went off track. And that's okay, Adriana.
I always
do
go
that
off
often.
track.
That's all right. That's how we get more value out of these lives.
There's
So just
something
to,
interesting in there. Good job.
yeah, just to reiterate my question, you can answer it and then Dave can go on. I was just asking if this body talk language and theory and method is used for physical, emotional, and psychological issues.
So how body talk works. Number one, we are looking into when we start receiving a body talk session, or doing, in my case as a practitioner, we are not looking for the symptom, and we are not really interested in the symptom 100%. Of course, we take into account that this is what the person or the animal, because I work on animals too, so I don't want to let them out. Like it's looking at what's going on in the person's body mind. That's what we are looking into finding out. And we are addressing history, we are addressing emotions, we are addressing root cause, which is very important to identify as to why somebody is the way they are at this moment. What led to that headache or that stomach ache or to that broken ankle? What led you to that car accident, and so on and so forth, right? Something was going on in your mind at that time that sidetracked you, or something that you've been storing in your subconscious mind or in your connective tissues for way too long, that just surfaced at that point in time. Because people think that diseases, as we call it, because it's something that is immediate and it happens overnight, but it's not. It's something that helps, it builds over time. So it's something that it's gonna, look at yourself, at your whole being as you are, at whatever age you are today, from the day you were born, or even before, when your mom's womb, whatever happened to her and to you then, and oftentimes can even be from other lives, right? Because we carry every memory, every knowledge from every lives we've lived on our blueprint, and we carry that over. So everything is experienced, and they all add on to each other. So sometimes it might be something that you've heard when you were a kid and you never let go of, without even having the knowledge that it's just stuck in your head, right? And that can affect your school life, and that can affect your relationships, and that can affect your weight, your body weight, or you know what I'm saying? So all that, if you look at somebody's body shape, you can, not me, but Dr. John Valtine can tell what is behind that person's story, how much time they have to live, because he can identify that. And he knows where the problems are. So that comes with experience and background and practice, of course. But so to say that our body is like a spitting image of what's going on, or a mirror of what's going on internally, right? You look at somebody, you can tell if that person has a good mental health or not, a good eating habit or not, right? Or if that person sleeps or not, right? Some things are more evident and we can pinpoint. So with that being said, we have to consider all aspects, different aspects of what's going on in somebody's life. So we are interested in body talking, clearing those memories, those traumas, fears, phobias, those belief systems, those patterns, repetitive patterns that we keep bringing up over and over in our situations, in our life interactions, either if they're relationships at home or with the loved ones, or job relationships, or money, or whatever it is, right? If it's good or bad, it's because of something that we held on to and we can't let go of. And Body Talk has all the tools to dig in and bring them to surface and clear that, so the body can do its job alone. Because it's important for people to know that the body knows how to heal itself. If you cut yourself, burn your skin, if you twist an ankle, you give your body a few days and things start happening again, because the body has what we call that innate wisdom, which is the internal body's intelligence that does everything that needs to do in order to promote good health, right? So it keeps itself on track. But we are very good as humans to derail that body and make it do different things. So we can start abusing of substances. We can start not sleeping. We can start, right, overeating, or we can start talking negatively to ourselves or to others. And then things just start building up. And when the build up of all those repetitive patterns happen in our head, what it does is that we will break down and interrupt the communication between the neurons or the brain cells and the different systems in our body. And this is what keeps us healthy and keeps us going, is if this communication between the neurons and the whole body is on check, is strong, and is fast. So stresses, as many people think, cause diseases, but it's not true. Stresses, they start decreasing the speed of the neurons, of the signaling from the brain into the body. And with time, that's when diseases start developing. It's not an overnight thing.
Right. But it does contribute, right? It does contribute.
Of course.
It's not an immediate cause,
no,
but it is an underlying cause.
Speed up the process.
Yeah, but you said before that, you don't really focus, or you're not looking for the symptoms. But you also mentioned headaches and things like that. Aren't those symptoms on their own? Isn't that classified as a symptom? I mean, without having, some sort of a symptom, how would you know something is wrong?
Well, we know symptoms are labeling, right? It's something that Western medicine developed. It's a system, it's a mechanism system to get us hooked up, to get us keep coming back, to have a reference point so we can see if that symptom goes away. So what's the tool that they use for that symptom to go away? It's medication. right? So, and that's our thermometer. So we have the thermometer of the symptom and the medication. Both of them have to be balanced in order for us to know that that is not there anymore.
Right.
Otherwise, we lose track of it. Now, if that's not there, then we in Body Talk, we are more interested in what brought you to have that, to develop that symptom. So, and then of course, if the person is experiencing headaches, let's say they come for a few sessions, and then that headache subsides, it's because we've worked on something else before that headache, you know, vanished or subsided. Because there is a need to clear, there is a need to declutter, there is a need to disobstruct, so the body can do its job. It's like bringing the brain, the body, the whole body from the sympathetic mode, which is the chaos, the fight and flight, into the parasympathetic mode, which is where we are more calm and relaxed and where healing takes place. And that's what we're looking for in Body Talk.
Right.
Amazing.
Let me take you guys back a little bit. Well, Adriana, you're going to take us back a little bit because we're way ahead and I'm not understanding what's going on. But I think you have a chart behind you that would probably give me some fundamental.
Okay.
Just explain what that means and what's on that chart.
So basically, for us practitioners, this chart is a GPS, if you will, for us to practitioners to navigate the body mind and find out the areas of imbalance, which can cover anywhere from consciousness, from organs, from environment, for endocrines, for relationships, and like the body, we can do cellular repair in Body Talk, meaning that we can repair any condition on a cellular level. We can work with body chemistry. So if there's any microbes, toxins, allergies, and intolerances in the body, we can address that too, without having you go do a blood work to find out if there's something happening internally. And we can actually not only detect, but we can clear those two. So we are inducing the body to do the job and to release it. And we can also work on memories that are held onto our connective tissue, which are memories that come with a charge, if you will, and we call them in Body Talk as active memory. Let's say if somebody has been abused, or somebody has lost a family member, or lost a baby, or went through a bad relationship, and if they talk about that or hear something or a song that can bring the trigger, if there is a trigger and there is an emotion attached to it, it's called active memory. So we need to release that. In Body Talk, we do release that. So we can start moving on with our lives. And then we can also work on circulation, on lymphatics. We can work on musculoskeletal. We can balance anything bone related, tensegrity of the body, the movements, and so on and so forth. So as you can see, there's Chinese medicine, there's chakras, there's everything on here.
Well, we can't really see, we can't read it. I can read Advanced Body Talk Protocol, but that's all we can see. So we know that there's a lot going on behind the scenes.
There's a lot, yeah.
Right? Let me ask you a question. Is Body Talk all about talk, or do you have to have any sort of, testing that somebody would need to work with you in person, or go to a clinic to do blood work or anything like that? Or is it all done online, remotely, as we are now?
So there's no prerequisites for anybody to receive Body Talk. The only prerequisite for them to be seen by me is to fill out an intake form and a consent form, so I know a little bit of their history. Other than that, if they want to attach any findings or any tests or something for us to for me to have the knowledge of what's going on, and also to serve as before and after, so as a person starts improving in their health status, then we can look back and say, hey, look at what you're like before, and now that's gone, you don't feel that as much, or it's totally gone. But no, there's none of that. What is necessary for the person to understand is that we are not working exactly as most of us might be used to. We are not looking at the body as the physical body only. We are looking at the body as everything like from physical and everything in between. So we're looking at physical, emotional, psychological. We're looking at energies, right? In Body Talk, we do work with energies because we use Chinese medicine principles. We use principles from different Eastern, Western medicines. That's why we can go so broadly. So we are looking at you in a way that you probably have never been looked at before, right? And we are interested into really scanning. And a lot of people might find a little scary because it's like looking at you naked in a way, because we can go inside and pinpoint sometimes what you're thinking, right? If you're happy to be on my treatment table or not, or if you're doubting me or not, because you want to, seriously, sometimes it comes up in the session. So if it's relevant for the body, and if it's in there, you're thinking about it, I oftentimes can pick it up, right? So, and it's good because in that way, that shows that the body can pick up everything that it's not pleasing it, right? Anything that needs attention. So how I communicate with that individual to make sure that I can go where I need to go to identify those areas of imbalance, I need to communicate by a certain mean. And in Body Talk, we use biofeedback, neuromuscular biofeedback, or applied kinesiology, which is very light touching resistance points that we're looking for on the skin. If I were to have somebody in person, I would usually use the wrist. If I don't, I use my own hands and my own fingers so I can find the resistance. I start then asking a bunch of yes and no questions to this protocol chart, and in order for me to find the imbalances. So those are going to start coming up to me in a mathematical formula, which is the areas that need to be looked at, healed, right? Integrated and healed by the body. And how do I integrate that all into the body mind is by using a very ancient indigenous technique, which is called tapping, which you might be familiar with the EFT tapping, right?
Had a guest, like I said last week, who was talking about this, right? So we learned all about the different tapping techniques.
Yeah, so in EFT, they use tapping of the meridians, the 12 main meridians in the body, which are correspondent to the 12 main organs in the body. In Body Talk, we don't tap the meridian points, but we tap the three brains that we have, well, the three main brains in the body. So we have the head, heart, and enteric brain, which is the AKA gut brain. And all of these brains, they have a role to play. So why do we tap somebody's head? This is the master commander of the body. This is where all the attention, all the awareness of everything that's happening and all the neurons are in check. And it's like an antenna picking up signals from everything we live 24/7, right? And if a fuse blows in here, then everything shuts down, right? So that's why this has to be active and in place out of without cold spots, as we call, because those cold spots developed by stresses, they start altering our thinking patterns and our behaviors and so on and so forth. So this is to bring awareness. And then we go into the heart to make sure that everything that's happening through the tapping is going to be distributed throughout the body, so the body can receive all that healing, all that information, right? So that goes everywhere through the pulsing of the heart. And mind you that the heart has many more neurons than there is in the head. So we're talking active brains. Then we have the main wording healing in the body, which is through the tapping of the gut brain or the enteric brain, because according to Chinese medicine, right in our abdominal, there is this small intestine, which is responsible for decision making. So if we tap on here, we are actually giving the body permission to decide to heal. And we are letting it say, yes, I want to heal, or I don't want to heal. So it's very important to do that. And not only decides to heal, but then you will digest all these changes that are happening in the body. And there's so many things involved in the tapping and the breathing, because while we're tapping, we are also inhaling and exhaling. If we are inhaling, we are scanning for areas of imbalance, right? And if we are exhaling, we are letting go. We are also scanning for other parts. So it's the lighter parts and the heavier parts, right? The emotions and the thinking as we inhale, and then the physical aspect of it when we let go. And exhaling is letting go of what you don't want anymore. Everything you've been holding on to. And this is very powerful. And why do we tap on here and with a certain hand position? Because the aim here is to reconnect the communication between the two hemispheres of the brain. So we have to make sure that this bridge covers the two and they are communicating again, right? So the cold spots can clear. And then we use also the polarity in our hands, the north and south polarity. So our energy field with the tapping is going to create, as you call in geography, a tsunami internally that's going to start changing everything.
Can you give us an example of the tapping?
Absolutely. So there is the main technique in Bodytalk is called the tapping of the cortices, which is a plural for cortex. And once we have this technique covering all parts of our brain, it's going to lower our stress levels and enhance every brain function and consequently every body function, because everything that happens here, right? So I start by choosing a hand and putting on the very base of the skull with fingers enclosed, okay? Either hand is good. And then you have to do the tapping. For each hand position, you're gonna tap on the head, on the heart, and on the enteric brain. Inhaling and exhaling for 2 full breaths. And then once you breathe for the second time, you go up 1 hand position, never leaving spaces between the hand positions, because we wanna make sure that we don't leave any cold spots behind. And we keep going up until we cover the front, from the front to the back, until we get to just above the eyebrow line. So it doesn't really matter how fast you tap, how many tappings you do, or the intensity of your breathing. It's good to do deep breathing so we can do the scanning, but everybody's speed is different. So if you get to the very top of your head, you can tap on your hand. There's no need to move it over, but you can if you wish. And
David's
then,
confused.
no, he's good. I mean, it's just going from front to back, Dave. You don't have to.
David's going from here all the way up
Yeah,
gradually.
don't skip any
I
positions.
lost my coordination
Yes,
somewhere
he
in there.
Look, but there's no need to worry, because if you go on my YouTube channel, I have 30 videos on a challenge that I did some time ago, and you can get the hang of it in one video. After you watch it, you can do it in 2 minutes. Then you do the emotional brain, which is the limbic, and then we go let go of 1 hand and tap. And then 2 breaths, right? And that's it. So this is a Cortices technique. If you do this technique alone every day, for now that this moment that people have been struggling with mental health so much, and people can use this at home twice a day minimum, when they wake up, when they go to bed, or as many times as they want, to bring their stress levels down, to start thinking, to enhance their memories, to improve sleep, improve body function, improve every body function in your body. And you can teach your kids can do it too. You can do it on your pets, so everybody can benefit.
Amazing. And you said you have these videos on your YouTube channel.
I do.
And
Go ahead.
that information is on the post. So anybody who is watching on Facebook and then the replay will be able to click on your link and view it on there. Go ahead.
Yeah, no, I was just going to say, because on the channel, there's not only this technique, but there's content too, like informative content, but there's also Bodytalk Sessions. So there's Bodytalk Sessions that people can watch and also receive once they're watching. So there's Bodytalk for immune system, there's Bodytalk for depression, anxiety. And so as I keep shooting the videos, I keep uploading them. So just if you subscribe, you always know what's coming up new.
Fantastic. And these are free for people to watch?
Absolutely.
Okay. And how long would these videos be?
It depends. I have short videos. They're like less than 10 minutes. If I do a full session, then they can go 30. I have maybe over 40, 45 minutes. Then there's some workshops. There's a workshop, full workshop that I did. And that one is a little over an hour. That was on another platform. And then there's also the same platform also asked me to explain the system in a much shorter time, which is there too. So there's things for all tastes, I guess.
Amazing. So that's really good. And maybe we'll be able to use some of those videos for the Explore platform for our lifestyle balance section, where you'll be able to be on there as an expert, giving your expertise and helping people along the way. So that would be really nice as well.
Great news. Thank you.
So, okay, let's kind of ask you a question here, because you said that you do this remotely, so you can work with anyone. How long would somebody expect to work with you? Could they maybe cure something within one session, or do they need to come back? How is it that you work with your clients?
So everybody's different. Every condition is different, right? And everybody's history is different. So of course, it depends on belief system. It depends on how open you are. It depends on whatever's going on in your life at the time, your stress levels. It depends on various factors. So I at least recommend like 3 to 5 sessions to start, just so you can start giving your body some time to start shifting, as we call it, and so we start seeing some results. However, not everybody sees results right away. You could, some people do, some people don't. The fact that you don't see results right away, it doesn't mean that your body is not shifting and you're not healing, right? And it's just like peeling an onion and getting to the core. There's many layers until we get to where we need to. So we require some patience and some persistence, right? And then things just start happening that way. It's good to mention too that Bodytalk is preventive medicine. So if you are tired of taking medication, or if you're suffering with side effects of medications, right? Bodytalk doesn't use none of that. So it's natural healing from inside out. And on the contrary, it flushes out toxins from the body. So if you are suffering, struggling with toxins and side effects, once you're receiving Bodytalk, things will start coming out. Yeah.
Okay. So let me ask you, you mentioned before that you can heal all kinds of conditions, whether internally or externally. So somebody like me, for instance, I have really bad eczema in the winter, my skin, because I come from a hot country. Even like, I don't know, so many years later, I'm not used to the cold. So I get very bad rashes and my skin is all dry. And actually right now it's very painful. I mean, I'm using medication, but it seems to be taking forever. And somebody posted, I'm bringing this up because today I saw on Facebook, somebody posted a photo of her hand and she said, I'm in so much pain. I've tried everything. Nothing is working. And then all of these, very well-intentioned people started commenting and giving advice. So they were saying anything from cortisone to all kinds of other creams and ointments and natural products and all kinds of things from the Dead Sea and then oatmeal and whatever. So are you saying that through Bodytalk, you can take somebody with a condition like that, or even, with my own, and heal us? Is that something that Bodytalk can do without treatment and ointments and all that kind of stuff?
Yeah, you can. The thing about environmental conditions is because, like you said, you're from a hot country. There's something that we can address in Bodytalk, which is your adaptability to new environment, even though it's not as new to you anymore. But there is still something in there that's, still connecting you to your birth country, or something on your mind or something on your emotions, and that can be why it's showing up on your skin as well. This is just one aspect of it, right? But there's those underlining aspects that we need to look at and see, but it's totally possible. Yes.
And so for a condition like that, how long would you have to work with somebody? Like, it's not something where you can give us an example now and just do like a spot sort of treatment, or, that kind of thing?
Not really. I mean, like I said, I mean, do 3 to 5 sessions, right? And see how that goes for you. Because I need to see listen, when I do my sessions, first session, usually identify the root cause. However, there's the clearing process, right?
Right.
So it's not only knowing where it's coming from, but then I can tell you, but then if you want to proceed and heal it, then you have to give your body time. But it really depends. I personally had improvement like with the one session only. Like I healed from fibromyalgia with one body talk session. Oh yeah.
Really?
I swear to God, yes. And I wasn't even
Fibromyalgia.
I received a body talk session and I used to not even get up in the morning from so much pain because I've had multiple injuries since the day I was born. I think counted maybe 13 injuries. So my musculoskeletal is not the best. But all these traumas led me to have inflammation, right? And you have to start addressing stuff. But I received one, and I even ran into the practitioner a couple of times and I said, thanks to you, I healed. I don't have any more fibro. And I had my pelvis adjusted remotely because from another injury. So my left side was forward. And for years, I had to sleep on my side with a pillow between my legs because I didn't have a balance. I swear, I felt when that adjustment was done because I felt when I didn't need to, that I was straight, that I didn't have to use that anymore. I think I was in bed at the time. I was like, what's going on? And since then.
That's really powerful because I know some people who really suffer from fibromyalgia. And if I were to send them to you, you're saying that very quickly you can help them get rid of it. You can cure them.
I mean, that was me, right? I had received body talk in the past, but again, I remember that one session cleared it, right? Other people, clients that I worked on, I had somebody who had been in bed with rheumatoid arthritis for 7 years. And after body talk, she's up. She doesn't use the walker anymore. Like she's like in her 70s, going 80.
Wow.
So again, everybody's different, right?
What happens with someone, for instance, who has a real medical reason for being in so much pain? I know somebody who has a shoulder where there's no more cartilage. It's just basically bone on bone. Tremendous pain. This is a physical problem. How is Body Talk able to help that where there's a physical reason why they're in so much pain? Like you're not able to refill the cartilage, obviously, or anything like that. So how would it work?
Well, surprisingly or not, body talk it's not impossible that cartilage can rebuild again through body talk. That's something that I even asked myself because I don't have cartilage in my neck either. And I've been working from the multiple injuries, and I had a big fall years ago and 3 concussions. I've had it all. So my neck now, I suffer with mild arthritis, but I've been working on myself for the longest time. And oftentimes we have to repair things in body talk on a cellular level, right? But it's a process. Like it's hard to say how many sessions or in how long, right? Sometimes it's an ongoing process. I'm not going to lie, right? Because there are other things that might be leading to that. So it's really hard to comment like this.
Okay. And in terms of an investment, like how much would your sessions be or a package of sessions for treatment? Could someone, gauge if it's affordable for them, what they would have to commit to? How does it work with you?
Sure. As you said, it is an investment because if you are correcting a problem, you're not band-aiding it. I think it's worth the shot because you are trying to get rid of something that doesn't serve you. So, and because it heals on a cellular level, body talk is an investment and no medication needed, right? So I start, like I said, you can do individual sessions, which are worth $140. and that is for adults and children 120, animals 120, and seniors 120. If you want to go package, then the regular package is 330, and then the discount is applicable to the other categories.
What does the package mean?
Three minimum 3 sessions.
Oh, 3 sessions.
Yeah, if you want to add more, let's say if you want to buy 4 sessions, 5 sessions, so you would pay each session 110, right? And just add them up versus paying 140. So,
all right. Okay. So you get a little bit of a discount from all.
Mhm.
And this is not covered by any insurance, correct?
No, unfortunately not.
Okay. All right. Fair
Let,
enough.
let, let me take you back a little bit again, because fundamentally, to understand something for me, I have to go through a process. So would you say the first process, like I like three-step process, 5-step process, that kind of stuff make a lot of sense. Would you say the first step is to release the problem?
Well, the first process usually is identifying the areas of imbalance. So I am, let's say, stomach, right? Your stomach comes up, and then we have to break it down and see if there's something else in the stomach, or if it's just the stomach in general that we're looking at. Then we're going to usually attach it to an environmental factor, whatever it is that might be contributing or happened that led your stomach to be experiencing what it is experiencing now. And then after those are started being linked that way, we look at all aspects. We look at sometimes at physiology and so on and so forth. Then we have a formula. But again, it varies from people to people. So this is just the process of looking at you. All I'm doing, even if you were to come to me and I'll say anything you have, I'm still able to pinpoint what it is you're battling with, because it comes up, right? So usually the skepticals, sometimes I even say, don't say anything. If I do shows, for example, as I used to, the Total Health show, there's a show that I did for years. And then we used to have a booth and people would come and lie down on the table and start having a treatment right there. And these people were just people that we didn't know, right? And then they would come back as clients and say, listen, you said something. And yes, that's exactly that. Or even after getting up, they would say, I can't believe you found it, or you touched it. I didn't say anything. But yes, so the body keeps no secrets to me. The body talks.
The body talks. And I understand that. So sometimes to identify the process may take a longer period of time.
It might. I mean, lately it doesn't to me. I can identify. It might take longer to clear it than it is to identify. Because again, we have to push and pull a little bit, right? and like your resistance or identifying in your trauma, sometimes it's something touchy that it's hard for people to go there, and they might try and hide it more. So there's different aspects, but we
And then
eventually
after
get there.
clear, what comes next?
Well, people, that's why when people ask how many sessions would I need, I find that the person is their best judgment, right? The person will start feeling better. They will start noticing that they are more mobile, or they are sleeping better, or they are not in need of that much medication anymore. And the best way to judge that is actually go back to the doctors and say, hey, can you please do me another blood check and see how my levels are? And if the doctor looks and says, wow, this is remarkable, how did you get to here? Because I've had people like that. And then the next step is to reduce the medication to the point where you won't need any anymore because your body healed.
Okay. So clear, double check on your clear, reduce medication, and then do we have to come back in a couple of years later, months later? How does that work?
Good question. Once you've reached the level where you're comfortable with your own health, I find that it's important to receive preventive Bodytalk sessions, as I call them, because if your mindset is the same throughout your life, good, but it's not, because we interact with our environment. So our environment is the one that brings on the stressors, right? And they are the stressors, and the stresses are developed by us. So if your interaction with your environment and what really bugs you is good, and you don't let yourself be interfered or bothered by any of those, guess what? You're going to have a great health. But if it's not the case, then you need to check in with me sometimes to bring those levels, the stress levels down, and then make sure that you're not developing more diseases, because body talk picks up everything that might be starting to form in your energy level before it even gets into your body. So I can detect, even if it's cancer, right? I'm not going to label and say, hey, I picked up cancer from your energy level. No, your energy field. It's not like that. But I will pick up something that eventually will prevent you from developing something further, which is great, right? Because it's saving you the trouble, right? The stress, giving your health back, and it's saving you money, right?
And how do you measure when to come back? Is that like a 6 month, a year?
Now, I always ask the body, right? At the end of any session, I will ask if further body talk sessions are a priority. And if so, these sessions can fall anywhere within days or weeks. Usually for first timers, you might see me today and have to come back within 2-3 days. Okay, because oftentimes it's because the body wanted to take in more in the first formula, but it was overwhelmed, so we had to break it down. That's usually the case. And then you would have to come back after a few weeks. Why few weeks or few days? Because that's the time that the body needs to process everything that was taken in, right? Whatever I integrated, the body will process it. And after that, it's ready to take on more or to release more. And that's when you keep coming back, right? Until you find, okay, I reached the level where now I'm fine, or I don't have the pain, or my eczema is gone, or whatever the case.
Mm-hmm. Now, you mentioned something earlier about depression and substance abuse and all of that. These are bordering on mental health issues. And some people might question just, talking, just looking at it from an external point, and especially not seeing somebody in person. Um, how do you address and do you have any examples that you can give us of people who have been helped, who have been healed and released from their mental health issues and problems through body talk?
There are a few cases. People who have problem concentrating, problem sleeping, right? I've had those. People who live in stress so intense that sometimes they start going like depression or paranoia. I've had all those. And those are more tricky cases because they are taking medication. And not only that, they have to deal with their stressors as well. So what I told you guys before about bringing the body from the sympathetic mode into the parasympathetic, right? So lowering the stress levels, I can totally do it. However, if you go back to the trigger, or if you're living in the stressful household, right? So you come and see me, you go back to the stressor, you come back, I clear, you go back. Then at some point, you will have to do something to change that. Because if what's triggering you, which I already then found out, is living in that household, for example, you can take body talk for years, but if you don't change, if you don't do your homework, then I can only do so much. You know what I'm saying? Because I can only try and help you, but I cannot help the person who's with you, if that is the problem, or the job that you hate, for example, right? And I've had people like that, and it would come up in the session all the time. Listen, you need to take action. You need to take action, right?
Well, you're talking to the right person. It was all about taking action, and you're talking to the right person because I'm all about the mindset and freeing yourself and making sure that you are releasing all of that negativity. Because the first step to growth and the first step to healing is obviously to let go of whatever is holding you back. And you may not know what's holding you back, and that's why it's good to talk to somebody like you or somebody like us to identify that and then work on how to release it. But you're right, unless changes are made, nothing is going to change, right? We need to start somewhere. So do you work with people also not just on their physical environment, but also on their relationships? I think you mentioned that before, and their habits and the way that they look at life, so their entire outlook and their mindset and all of that. Is that one of the first things that you work on? Because that's certainly what we do when we work with our clients. First thing we do is look at their mindset, because that's really where it starts. It all starts
Yeah.
with us, right?
Exactly. So, and if you're a coach, for example, right, a life coach, what you're looking at, you're looking to change somebody's pattern, right,
Right.
behavioral pattern, or develop some that they don't have. But that's the thing. You can only do so much for that individual, because then the homework is going to be given to them, and you're going to say, listen, you have to go and work on clearing those. And but how do they? That's when they will need something deeper this way, that will actually go into their subconscious mind, because they don't have access to their subconscious mind. None of us do.
Right.
We don't know, right? And that's the subconscious mind oftentimes functions as a defense mechanism to prevent us from suffering and dealing with the pain. So if there's any abuse, any mindset, something from your parents and this and that, sometimes you think that you are doing yourself a favor because you're following your parents' footsteps, right? And guess what? They had like a bad mindset towards money. They couldn't save any, or they would spend so much, or they could not make, for them it was just work, 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 work. And maybe that's where you come from. You think you have to work super hard in order to achieve whatever you want, right? So how do they detach, right? Then body talk can be of great help towards that.
Mm-hmm. That's wonderful.
Yeah.
Look at
Absolutely.
Dave. Dave is like, yeah.
Yeah, he's in thinking mode. That's why I'm pausing to let him ask his questions.
I am in a thinking mode indeed, but you mentioned some of the disease earlier that you're able to affect in a positive way. I just want to go over that again because Verita and I was talking earlier, and one of the things that we see in this environment that happens a lot is the mental health issue that's happening, especially with kids, because they're locked away for a year or almost, and they don't know what to do. So
Mm.
those are, I believe, some of the issue that you can help. How do you address those things?
Absolutely. Again, so mind you that for the first 7 years of our lives, we are totally attached to what we live in our household. So that will mold who we're going to be as adults, right? So this is like a big trauma, this COVID thing for a lot of kids, right? Because this is going to mold them, who they're going to be in their future. For us, I mean, we've seen better days, right? They are just seeing these days because this is like the peak of their childhood. They're supposed to be out and playing and interacting. And so how do they not? How do you tell them they can't? And they don't even understand, because where's the virus, right? Why are we wearing a mask? And that goes for anybody who cannot really grasp this idea. This becomes overwhelming to the point that we don't know what to do with it. Nobody does. We're trying to be creative, but a kid cannot be creative. So that's where body talk can help to come in and to release those stressors from the mind and start making them regain confidence, right? And trust, because oftentimes this is going to affect how they trust the environment, they trust people and community and the society in general, right?
Mm.
Because now nobody wants to get close to anybody. Imagine in the future, what kind of relationships will these kids have?
We just had Dave and I just had this conversation this morning. We were on a phone call, and I said, you know, unfortunately, kids right now are being raised, they're being born into this environment. We, at our age, and I'm not dating anyone here, but, at our age, we have already had our 20s, our 30s, where we were going out and partying and going to clubs and doing whatever we needed to do and dating and, being out there and developing our social skills and knowing what life was really like. Now, life is not the way that we know it. But we've had our chance and we've done it. All of us here, we have kids, right? Um, and so for us, getting used to this, I mean, it's hard to get used to the online world as solely your only way of interaction, but it's easier for us because, we've been there, done that. We've had our experiences, we've lived it. Now, our children are supposed to be doing it, but they can't.
Mm.
And so for me, my daughter is her first year of high school. This is not a high school experience. This is not the way that we should be raising our kids. This is not how we socialize and interact and form relationships. I mean, they have no chance. They have no chance to bond, no chance to make friends, to have a social circle, to date, to do anything,
Mm.
right? And like you said, the first 7 years are the formidable years where we're really sponges and we're learning everything. And this is what shapes our reality for the future. These are the earliest experiences that we absorb and we carry forward. Now, what happens and what I believe is going to happen is that as COVID, whether it gets worse or better, it doesn't even matter at this point because we're losing so much time. For us, it's just, a year or 2 years or however long it's going to take. For a child, that's an entire lifetime. These are years that they're never going to get back.
Mm.
And so what happens is because they're not doing what we're doing now, socializing with other, people and having discussions and learning how to interact. And of course, we have our whole life where we've developed social skills. For them, they're still developing those social skills. Now they're doing it with, and as Dave was saying, mostly texting, right? Because they're not even doing the entire Zoom thing and the other platforms. They're doing it mostly by gaming, or they're doing it by FaceTime sometimes with one or two people, or they're doing it texting or just phone calls. So what's happening is that their social skills are not being developed and everything else is not being developed. So the healthy way we know of growing up, developing and being able to form healthy relationships and healthy interactions with other people, it's not happening.
Mm.
So we're going to end up with young adults and adults who don't know how to function when life, God willing, will be resuming, right? They're
Mm.
going to go out into the world and they're not going to know what to do. And
Exactly.
all of the words that we're using, if you think about it, as I was saying this morning, we're using isolation, social distancing, all of the negative words that are being fed to them. That's all psychologically being absorbed into their minds. And these are all barriers, right? So these are all enforcing negativity. They're not enforcing positivity. It's not
Mhm.
about, keeping healthy and we'll get through this together and all of that. All of those fancy, positive words are being clouded by the negative words, the isolation, the keep 2 meters apart, the, like all of these things, distance. These are much more powerful than we'll get through this together. So what we're doing is we're teaching them to be alone. We're teaching them to be on their own. We're teaching them that you can still live without having other people around or be in your bubble. Like these are not healthy ways to be raising children, right?
No.
Even sending them to school now, they have to wear masks all day. There's no mask break even outside. That's not really healthy for them either.
Mm-mm.
And it's like what you were saying. The mental health aspect of it is it's in such danger, and we've seen people that are giving up on life. People are losing their fight for life. They're going into
Actually
depression
taking their own lives.
and they're taking their own lives. And we've had this
Yeah.
recently. Um, you know, I've heard of more than a few, and at a young age. So we're losing our fight. We're losing our passion. We're losing our hope. And I mean, as much as we want to give them that hope, as much as we want to inspire them and motivate them and say it's not going to be forever, it's just for a little while,
Yeah.
it's really hard for people who are, they're just so thirsty to have interaction and another person beside them and a circle of friends and going out and being able to express themselves. Their life came to an abrupt halt. There,
Mm.
overnight, there was no more socializing, no more movies, no more restaurants, no more nightclubs, no more dancing, no more, sporting events, concerts. Everything that people were passionate about came to an abrupt halt. Now,
Mm.
we might be strong individuals where we understand, we have a better emotional intelligence, we teach other people, and we're able to cope. But
Mm.
how many millions of people out there are not?
Mhm.
Right? And we can't reach everybody. That's our mission, is to reach everybody, but we can't realistically right now anyway. So how do we get to those people? How do we save lives, right? Um, how do we help them? I don't know. We came up with a few suggestions and ideas today, things that we're going to be introducing and hopefully implementing in the near future. But in the meantime, we're just afraid of all those lives that we cannot reach. And how do we help each other? So mental health checks, we think, and I think, I'm veering off topic here, but it's important to say, since you brought it up, Dave, mental health checks are really important. And just because somebody tells you they're okay, don't take it for granted that they are.
Mhm.
Probe a little bit deeper, right? Talk
Mhm.
about body talk, learn body signals, language, try to get them on video rather than just by phone. Make sure that you're talking to them a little bit more often.
Mm-hmm.
Ask a little bit more probing questions, not just surface questions, and really let them know that you care. It's not about just asking the question and then moving on to the next topic. It's no, no, let's stay on this for a little bit. Tell me really, how are you coping? How are you spending your time? What are you doing?
It's
Right?
funny that you touched this, and I'm just getting the bridges, and so their cognitive abilities are compromised because, right, they're what do they know? They don't develop, and of course they're very limited. They're becoming more and more limited, like
Right.
atrophiated almost, right? Their brain
Mhm.
is not expanding. And another thing that about this interaction, how do you change this? Well, body talk is powerful in such a way that it changes energy, right? It does. And it changes matter, because matter, what is matter? Matter is energy vibrating at a very high speed that gives us the idea of solid, but it's not. So what do? I change matter. I change energy, changing energy, right? Solidified. So that's what needs to happen. In body talk, when you receive sessions, you're not only changing your internal body, but you're changing your environment. So the more people that start receiving body talk, we start talking on a higher level, things are going to start expanding. Things are going to start going larger distances. You know what I'm saying? Until we start moving energy on the planet, because that's what people are in need right now. People are in need of body talk practitioners like ASAP. And people need to start receiving body talk yesterday. I'm not talking about me, because that's how I started body talk, because I needed to start receiving it then. And
Mhm.
energy therapy shows up to you when you're ready to receive it. Otherwise, you'd never hear of such a thing in your life. And this goes for everything. When you're ready,
Mhm.
things just pop up, and like, oh, why did I just come across this now? Because
Yeah.
you're ready.
Right.
And so I think that the more we talk about body talk, the better. Body talk has been integrated into a regular Western healthcare system in Brazil. So there's paramedics that perform body talk emergency techniques, right? Because there is body talk has emergency techniques for bleeding, extreme bleeding, or seizures, or fractures, until you go and receive the healthcare that you need. So people are more and more talking about it. And I remember when I started talking about body talk 10 years ago, people didn't know about it, but now they do. And I've heard, I don't remember his name now, but there was this doctor that told, somebody told me that this doctor said on a live, the world needs body talk. And he's right, because we need to address mental health and physical body at the same time. We cannot leave the head alone. This is the pure Cartesian method mentality that Western medicine uses. But they forget to tell the population that everything that happens in our body starts here first. And to not have these people go through suicidal events, right? Or to not develop no relationship whatsoever from being terrified, right? Not even having a skill of knowing how to interact with somebody, because people don't know anymore, right? And not only that, body talk strengthens the immune system of each individual. So the better way to strengthen your immune system is to start receiving sessions so your body starts developing the strength mechanism. Then you're not terrified from being outside. So, and another thing for kids out there, if they're in school, or parents saying, maybe there's a few moms that will be watching this, if they want gather their kids, we can work on a group setting. right? So body talk can be done on one-on-one or can be done like on a group setting, both remotely. So everybody who's, linking themselves, like gathering because of that mindset, let's say, let's work on depression, mental health. Absolutely. Doesn't matter how many people, everybody can receive.
Hmm. I think it's really important, and I think it's definitely something worth considering. And Dave and I will discuss it and see if this is something that we can incorporate into our coaching program, and if we can bring you in and offer it and see how we can help everyone out there, because it really is important and it's a subject that most people do not like to talk about,
Mm.
but they must. And if we ignore it, it's just going to lead to more loss and, in many areas, whether it's just, depression or substance abuse or loss of income or suicides or anything like that. This is really, like you said, preventative. And I think when people start to understand what it means to really help yourself on a deeper level, then they can guard themselves and arm themselves, right? Just like, you're going into war, you're going to want to wear all the protective gear and you're going to have all the ammunition available to you to protect yourself. That's really what you need to do. I just want to ask you a question. It's funny that you mentioned, not funny, interesting that you mentioned that energy is a real physical matter, a real thing. And I've heard that before. I didn't really delve too much into it, but I have heard that the energy is really something tangible. Like it actually physically changes things within your body. And we look at it like it's just, and it can affect things around you as well. I didn't get into it too much, kind of like scary a little bit. But can you talk about that and just explain what that means, and really how you can manifest that energy and manifest a change using that energy?
So energy is not seen to bare eyes
Right.
because we don't, but we feel it. And when it's windy outside, we can see there's wind, but we don't really see the wind, right? That's energy. Or if you do like a compressed energy between the two palms of your hands, what do you feel? Pressure, right? Energy, compact energy. So it's we all made of particles, many particles, so atoms, protons, and cells. So all these are vibrating inside our body. That's what gives us life.
Mm-hmm.
And where do we come from? Where does this energy come from? We come from one energy source. Everybody does. And you can call it prana, you can call it God, you can call it Krishna, you can call it whatever you want.
Right.
Right? But it's, at the end of the day, it's energy. And we all coming from the same energy source, and we resemble that energy source, where similarities are the same. So that's why we're all alike.
Mm-hmm.
And that's how we look at the body. So it's about really how are we going to direct the energy, right? Are we going to store the energy in the body? Are we going to let it flow its course and go where it needs to go, or we need to give an outlet and let it out? So the energy and how we interact, we using our energy as well, right? And so how we treat energy, it's about really knowing where this energy is going and where the thoughts and the energy they start mixing to each other, because that's why in Body Talk we start looking at how your thoughts can start affecting the energy. You know what I'm saying? So it's gonna start. They combine. They merge. Everything is one. So there's no way, at least under Body Talk or any energy therapy, that you can separate one from the other, because one highly influences the other, right? And so by changing the way we think, we are able to change matter or energy, because they are the same. So if we start changing your thinking patterns, you start changing matter around you or your environment.
You also view your environment in a different way.
And
So
this
it's
is,
not,
yeah, go ahead.
yeah, it's not necessarily that you're changing it, but now you're realizing that it's different than what you originally perceived.
Yeah, you
right?
alter it, right? Like because it fluctuates, but and you are the number one resource of changing this. Like you're the one that exerts force onto things. You're the one, right, moving it. So you can. This is physics, right? And also quantum physics. You can move matter with your energy, with your thought,
Right.
right? And you can alter it and mold it to how you want it to play it in your reality. So we are 100% responsible by everything that happens in our environment.
Hmm.
We mold it the way we perceive it. Everything we see here, we see here.
Right.
Right or
And
wrong?
it's also it's right, and it's also what we allow, what we tolerate, what we accept, what we settle for, right? What we invite in, right? We can change all of that. It's up to us. We are accountable to ourselves. So at some point, we have to take responsibility for our situation, because
Yeah,
if we don't like our situation, we can change it,
and
right?
diseases is the same. Like people, like they always victimize themselves as to why they developed something, right? Nobody developed anything. You're the creator of everything in your world, as hard as it can sound, because people can have difficulty grasping why a kid suffer tremendously sometimes, right? But this is not our only life. This is not our only body. So there's a history behind it. Either you agree with me or not. And I'm not talking about religious beliefs or not, but this is how we are. We're infinite beings.
Right.
Well, I mean, but there is a religious aspect to that, because we do, I mean, those of us who believe, we do believe that, God puts us here on earth for a reason. We have a mission, we have a purpose, and, we have, so I'm Jewish, and we believe that, there's a purpose. We're on a mission here, and there's something that we need to fix, to alter, to correct. And so whatever happens to us on this earth is part of the bigger picture. It's part of God's plan for us. We do have free choice, though.
Mm.
What we allow, what we don't. We have to make the right decisions. And of course, you're being guided by your own, philosophies, beliefs, whatever. But when you're always doing the right thing and understanding that everything happens for a reason, then it's easier to accept things and to be able to work on them. And as much as, we say body talk heals, and this heals and that heals, and every different, practitioner is going to come and say that their thing works really well, and that's, the cure and whatever. Ultimately, we are given our knowledge, I believe, through God. God gives us all the resources and all the knowledge and everything else. And we are just messengers, right? But everything happens from the universe. Everything is already there for us to just, it's there. All we have to do is reach out and grasp it. So when somebody comes into your life with something that says, I can really help you with this, then maybe that's the answer you've been praying for. Maybe that's the thing that you've been asking for.
Mm.
Now it's here for you. You just have to take action, right? Today
Mm.
it's all about action. Is I'm getting this lifeline. Let me just take it and accept it and say, maybe this is what I've always needed. So you have to know, you have to recognize the things that are put in front of you and why. It's not by coincidence that we hear certain messages or hear certain talks or, come across certain information. It's all for us to absorb and to use and to put into practice. So I do believe that religion plays a big part into it. And people who don't believe in religion believe in the universe. Whatever you believe in, there is a reason for everything. So if it's put in front of you, if it's given to you, these are blessings. They're gifts that everybody. People say you're gifted. You're gifted with a brilliant mind. You're gifted with music. You're gifted with whatever. So use it. You wouldn't want to waste it, right? And I think that it's important for us to remember that if somebody's offering you a solution, then why don't you explore and see if that will help you, right?
Yeah. I find that we're all blessed because we're all given with this life.
Mm-hmm.
And this is our gift, and we have something to do, or many things to do with it. And some people choose to, or some people choose to not to. And so what do we do with the gift, right? How do we change this hologram? Because we can paint. The canvas is here, like I said in the beginning, we can change and paint it the way we want. Like it's blank, but it's up to us how we're going to build our life, right? So we want to sketch it, or do we want to, you don't want to sketch it, you want to just jump in and see where it leads you, right? But we are in control, and that's important to take accountability for, right? That whatever you do, either you choose to heal or you do not choose to heal, or maybe it's part of their spiritual path too. Maybe they're not meant to. I mean, there's different aspects or point of views that you can look at, right?
Right.
Everything
And
at the right time.
and I look at it as a way to serve. So your way of serving is to help people with all these different issues, to have a solution to them so that they can do what they're great at, or they can go serve what their purpose was meant for them to serve.
Yeah,
That's
and
the
it's
way I see it.
funny. It's funny for talking about purpose because, of course, nobody's born knowing their purpose in life. And then it took me different routes until I realized that my purpose in life is to heal. And my connection with healing is deeper than what I thought. Because today I look back and I say, oh my God, everything led me to this. Everything, and everything that I've always labeled wrong in my life. And I'm like, why the hell me?
Can't run away.
And now it all makes sense, but I had to go through the depths, right, and hills, and until now I understand. My plateau? No, nobody's life is plateau, and if it is, you're dead, right? Because you have to keep moving forward and playing the game. And now things make sense, and my connection is even bigger towards animals, and people who know me on a personal level know about that. And I find that that's my mission that's very close to my heart. And so as much as I can help, I'm here to help. And I cannot cross my arms. And when we're growing up, that if you were to take action in public and do something that people can consider, oh my God, she's so avant-garde, or she's so forward, whatever you want to call it, right? When you start getting older, you don't mind you don't care about what people say about you, basically. And you just do it. And if if you're to jump to rescue, you jump to rescue, right? Without being, oh my God, are they going to talk about me? Am I going to, beyond? You just do because your consciousness leads you. And that's the beauty of it, I find.
Crazy people change the world, Adriana.
Not only crazy, lonely people. And the fact that you probably relate now, looking back, only the lonely are the ones who are going to rise up, because I've always detached from my family. I've always, detached from bigger groups. I've always been, me, and like now in my adulthood, much more. And now I know that I don't relate to others on the same level. And I grew up like half my life thinking there was something wrong with me. Because why don't I fit in? Because I wasn't meant to fit in. I was meant to stand out.
Right.
But here I am.
So we all agree on that point. I believe we're all meant, all three of us anyway, to stand out.
Yeah. Yeah, follow your purpose. It can't go wrong. And if your purpose is to receive healing, or if it's to heal others, whatever, you will touch you. So, and if your time is now to receive help and to receive healing, reach out. I'm here to help. I'd rather to, know what's going on and prevent from somebody from going through something very nasty. And that's what we don't want, right? And if somebody's out there struggling that needs help and have dealt with the burden for way too long and don't know what to do with it, please reach out.
Absolutely.
Yeah, it's really important for people to remember that there is help. And there's always somebody that, if they can't help you, they'll find somebody to help you. And you're never truly alone. We are all here to support each other, to elevate each other, to comfort each other. And we all want the best for one another, right? Dave and I, we do this show, not because, we have extra time on our hands, but because we want to help We want to be able to improve the world, even if it's one person at a time that's watching or whatever. We just want to give back. This is our paying it forward. We want to encourage other people to do the same. We do not charge to have guests on this show, and we just want to provide value to our audience. It's really important that you do it from a heart-centered place and for the right reasons, and that's why we do it. So when we're giving these episodes and where we're asking experts to come on here and share their advice, they are also giving it of themselves, and they're not getting paid for it. They're not paying for it. This isn't, an infomercial. This is really something where you're getting genuine information and lots of value as a viewer. And we hope that you appreciate it. But we also want you to know that whenever you have any issue at all, you can always reach out to us, and we do answer our messages, emails, phone calls, whatever. We always get back to you. There is somebody here who would like to ask a question, but they're not putting it in the chat box, so I'm not sure what the question is or if it's a comment. So we're just going to give it a few more minutes, but if
Let me
not,
chime in with a question in the meantime as well.
Sure.
yeah.
At this point, we have learned a lot from where we started till now. So maybe you can just go back again and tell me, who should we send to you? Who are you looking to help?
Well, there are three areas that they're really close to my heart. I like to work with mental health. I like to work with relationships and injuries. And I find they're all connected. They're all connected because our mental health status is going to lead us to relationships, positive or negative, right? And the first relationship that we're looking at is the one with ourselves, right? Because if we can't even stand each other, right? Like us, for example, like you look in the mirror, like, do you like who you see, right? Are you suffering with something that's really holding you back? Do you have any traumas, anything buried in there that it doesn't let you look at yourself as that beautiful human being that you are? So I like, number one, mental health, because I really connect to that matter. And relationships, like, if you're struggling, if you don't know what to do, how many people are going through divorces these days just because they're locked up and they don't know what to do with each other, right? Which I find is very sad, to having to find out things under these circumstances. But any other reason that you might be struggling with, let's say you've tried zillion pathways, you've tried medication, you've tried, I don't know, whatever else, but didn't work. But if you're resonating with this, if something, if you struck a chord inside of you, then if you struck a chord, I think it's your call. Then reach out, right? It's a very personal. Energy therapy has to be on the energetic level. You have to connect, right?
Yeah, and I mean, you said here that some people have gone through breakups or divorces or whatever, because these are challenging times when you're in close quarters with people 24/7. Basically, you grate on each other's nerves. But I've also heard of a few couples that repaired the relationship because they were forced to be in close quarters, because they didn't have a choice, because the alternative is to be alone. So I've heard of couples reuniting, families healing because they're together. Because before they were, doing their own thing all the time and not being together. And now that they are, they've, recognized the magic of family bonding time.
The forced therapy.
Exactly, right? So it's just like throwing kids who are fighting all the time and putting them together to talk it out. It's sort of like that thing. So there is some good that's coming out of it too, although the majority is the negative. I just want to read here. We have a few comments from the audience saying that someone had done some sessions with you, saying you're amazing.
Hi, Chris. I see her.
Okay.
She's amazing too. I love her.
Okay, and that you treated some allergies, your intuition and energy are wonderful, and that you're the best.
Thank
So
you.
I just wanted to read that out to you. And yeah, again, if there's anyone out here who's watching and who feels that they would benefit from reaching out to you and having that conversation, do you provide a free initial consultation or like some sort of discovery call or? Anything
Yeah,
like
if
that?
they want to do something with me, I can go a good 15, 20 minutes with them if they want to see on the personal level. Or if they want to just see what a body talk session looks like, then I would say watch the videos on my channel. That's another option. Because it depends, right? You really have to, I cannot do like a half session, right? I mean, I can, I can put the focus on doing like a couple of things, but if they're expecting to get healing from that demo session, if you want to call it that way, then I don't think it's going to go that route. But just to see how it's done, and the YouTube channel can illustrate it. But they can call me with any questions they have, and and then we can go from there. And if they still want the demo, by all means, I'll do the demo.
Great. So you have options. And if you feel like you want to learn more about what Adriana does and about Body Talk, go to her YouTube channel where you'll find these videos. You can reach out to her by phone or by email. All of that information, again, is posted where you saw this promoed. And whoever's watching the replay, again, everything will be posted on there as well. And if you have any questions or comments, you can always put it in the chat and we'll be able to respond to that. Adriana, I do want to thank you so much for your time and for being here. And is there anything else that you want to leave, any parting words or, I don't know, some more wisdom you want to impart on the audience?
So all I can leave you guys with is with a healing tool, because if I could reach out to every one of you, I would, but you can reach out to me. But until then, I'll leave you with the Cortices technique that I would encourage all of you to start tapping. Go on my YouTube channel to watch a video again so you can get the hang of it and do it every day and share with your family, friends, and school or kids. If you're a teacher, you can introduce that practice before your class starts. And don't give up, reach out, as Vered said, and there's help. And another thing is that I'm doing another live event on Facebook tomorrow, and that'll be at 5 p.m. With Cassandra McSack. And if you want to look up for the link on my YouTube page, on my Facebook page, sorry, Adriana Barros, you can find me there, and the link is right there. So hopefully tomorrow, if you didn't have all your questions answered today, by tomorrow, hopefully you can then ask us something else, and I can help you then.
And that's tomorrow, February 25th, 5 p.m. Eastern Standard Time?
Eastern Standard, yes.
Okay, good. And then there will be a replay of that as well because all lives are recorded. So you can always go back if you missed it. If you're watching this after the fact, you can go to Adriana's page and you can look by date. So that will be tomorrow, the 25th of February, 2021 at 5 p.m. Eastern Standard Time. Dave, any more questions?
Thanks for being here. We appreciate your time. And it's well spent.
I am so pleased to be here, and I've had goosebumps maybe 3 times, and as I'm talking now, I'm having more. So thank you for your energy. Thank you for having me. I've wanted to talk to you guys for a long time. I had to wait a long month until today, but it was so worth it. And it was so good to reconnect with you, Dave, that we've had the pleasure to meet in the past. And I'm very pleased to have met you, Verd, and you're like just a breath of fresh air. You guys are awesome. And if we can do something together in the future, by all means, I'm here to help. And Chris, thanks for hopping on. Thanks for the support.
Okay, thank you so much. We're going to end the live right now. And remember to connect with Adriana or Dave or myself for more information. For now, have a wonderful day and we will see you next time.
Blessings, guy. Bye.